For a nurse with an associate's degree interested in nursing or clinical informatics, I would say target digital health startup, target traditional clinical or nursing informatics roles, or you can target roles in clinical documentation integrity. A lot of these roles are looking for nurses with associate's degrees or bachelor's degree, or they're simply looking for clinical people, whether they are nurses or not, that have a specific specialty experience and can bring an innovator's mindset to the new digital health startup or to the project that they're working on. For example, this is a health startup company that's looking for a nurse coach, but what this nurse coach is actually doing is providing education to a specific population to help them reach their goal of a new algorithm or a new platform that they've come up with. And they're looking for a nurse who has an associate's or an RN degree. A nurse who is dealing with clinical documentation integrity is very much in the middle of the payer or reimbursement system, in the middle of the documentation process, reviewing charts, and then is communicating with providers, doctors, other interdisciplinary team members, and you're very much in the middle of all of that healthcare information management, which is also a relevant role in the nursing informatics realm. And then the very traditional roles like nursing informatics specialist or nurse data analyst is not all one size fits all, which means there are roles that are really looking for experience or the special clinical background that a nurse brings, who has the innovators. So I hesitate to throw out types of positions, specific job titles, because they all very much vary. But I will say to focus on your clinical specialty, where you're at, how you can kind of find these jobs is thinking about the gap that your patients are facing while they're there in front of you, whether in the clinic or the hospital, or after they leave, meaning where are the places that they're going and how does their health information get managed, or what kind of technology are they facing once they leave, where you can take your clinical experience and insert it there. I help nurses pivot their careers strategically and not necessarily reactively. Follow for more.